before the general election, 2020 and 2024, we did have one of these campaign get-togethers just before the general election, but just a refresher for people who are new to this. And of course, it was a tumultuous year. We started off in Downing Street at the end of January. You'll see the picture in the top left there. We've got our chief executive now, Dan Knowles, with Theo Burrell and Danny Clark and Sam Surukaimer, and the campaign Nicola Nuttall taking in a petition to Downing Street with 81,000 signatures on it, which is a huge amount. Actually, not many charities get anywhere near that. We've got that to that level and over three times. And it was a great opportunity actually for a lot of PR. And also, we had our first meeting with the then new Health Minister, Andrew Stevenson, who's Nicola Nuttall's MP. So an excellent start to the year. And the other thing to say, the reason we got, I think, to this sort of level of petition signatures is that year on year, we're talking to more and more of you. Some of you I've known for a long, long period of time. Some of you have only just got to know. And we send my campaigning update now, goes out to 1,500 people a week. And we have a campaigner in 550, that's 85% of UK constituencies. Now, from the next photograph on, you'll see we're in one of the committee rooms having an APPG meeting. They're very grand, ornate buildings. It's a huge pleasure to go in there. But the APPG ran throughout the year, right up to the general election, in fact. We went through the process of doing our AGM about 2 weeks before the election was called, but when we had to do it all again afterwards. But we were active, particularly chasing up the recommendations from the inquiry report from 2023, Pathway to a Cure, Breaking Down the Barriers. And in many ways, the campaigning of brain tumour research is almost synonymous with the work of the APPG. But we do branch out. And one of the great pleasures of the period in the run-up to the general election was the meeting at the top right there with myself and Karen, met with George Freeman, who's been in our camp for a long period of time, and Will Quince, who we'll be hearing from later. So we had representation from health and from science, and it was a really illuminating meeting because, as you can see, it was a bit more informal, and it was really a chance to explore different ideas. And we certainly came away with a new way of looking at things. That was a great meeting to be at. But the election came. We needed to be out of the gates quickly. We were out of the gates quickly. We produced our manifesto, which was already in place, really, but it was a manifesto with the election in mind. It was called "It's Time to Do Things Differently." And the reason it's time to do things differently is because if we do the same, we'll get what we've always got. And that isn't of any use to the brain tumour community. For too long, we all know we've stagnated and we haven't moved forward. So the whole idea is do things differently. And as it turned out, we were going to do things differently with a different government. But we launched it with the previous government. Andrew Stevenson again was there. The person holding the manifesto there is Daisy Cooper, who at the time was Lib Dem spokesperson for health. But it was a tremendous launch event. We had five either current or previous ministers, another 20 plus MPs and people in the Lords. And our request then to our community was to go out and take that manifesto and talk to what were then your PCCs, your prospective parliamentary candidates, and get them on side. And there's Alison, who we were just talking to, with John Glenn, and Matthew, who I expect is probably on the call now, talking to his MP, who didn't actually get through, but still was on side. And you never know, people come back in politics. So that was before the election. This is after the election. So same thing, really. Now, instead of prospective parliamentary candidates, you've got new MPs. And if you look in the top left corner, there's myself and our founder, Sue Farrington-Smith, with our new MP, Callum Anderson. You've got Nikki Hopkins, a very well-known campaigner to many of you, with Sir Nick Dakin. And then you've got Stuart Anderson with constituents Alison Lilly, all just saying, you've made that commitment. What are you going to do about it? Are you going to get involved with primarily the APPG? So the photograph at the middle top, which has got the laptop in it, that was the first meeting of the APPG, which took place last week. We had already registered the group. But then we had our first meeting, and a fiery affair it was indeed, because we have a new chair who will be known to many of you. Her name is Dame Siobhan McDonough. There's me standing next to her. It looks like it's in a hotel lobby, but that's actually Portcullis House. And she, as many of you will know, her sister Margaret died of a GBM last year, and she has got real fire in her belly to make a difference in this space. So we are looking forward to working with her. We had the NIHR in for a bit of a grilling because they promised money into this arena 6 years ago, and that money hasn't been deployed, and we were chasing that up. Just to go round the rest of that slide, there's a picture on the bottom right of myself with two colleagues from other charities, from our brain bank and the brain tumor charity, with Minister Gwynn, I'm sorry, Andrew Gwynn. He's the health minister at the moment. We met with him a couple of weeks ago to explore areas like brain tumours fitting into the 10-year health plan, access to whole genome sequencing, and particularly from my perspective, we were looking at making sure that new technologies and new devices can get UK market access with alacrity, because we need to move things forward very quickly. So I'll talk a little bit more about that in a second. The other two pictures, there's my colleague Thomas buttonholing, Wes Streeting at the Labour Party conference. He'll talk a little bit more about that in a second. And then the bottom one on the slightly to the left of middle is me on the BBC Breakfast sofa with Glenn Campbell, the BBC's political editor, who has his own brain tumour diagnosis. And so a political beast, but also someone who gets out and represents the charity. He's made a very moving film about his own brain tumour journey, and I'm sure that a lot of you have seen that. I really recommend it, and if you want the link to that, just get in touch. So what does 2025 hold? Well, we've got, in the top right, we've got myself and Thomas with Scott Arthur. Scott Arthur is a new MP, and he's got the chance to take forward a bill based on the fact that he feels that where rare cancers are concerned, there hasn't been the progress that we've needed. And he has said there are no clinical trials to improve outcomes for the 3,200 people who have been diagnosed with a glioblastoma. That is because there is no financial incentive for the pharmaceutical industry to run clinical trials for such a small patient group. I hope to base my bill, this is a private member's bill, on a tried and tested approach to address this. And this is where we're working very closely with him. And this is the 1983 Orphan Drug Act, which was introduced in the USA to provide financial incentives to attract industry's interest through an extended period of market exclusivity for a drug approved to treat an orphan disease. Now, when this act was launched in the US in 1983, there were only 10 drugs for orphan diseases on the market. However, by 2015, there were 550. So there really is a proven way of getting more drugs into the marketplace for rare and less common cancers. And that's what we're supporting Scott Arthur with. So that's a really promising development that we're working with. Now, just moving across there, of course, we're going to keep working with the APPG on brain tumours. We provide the secretariat. On the top right is a picture of Kami Badenoch, and we've written to her last week to welcome her in as the new leader of the Conservative Party, but also recognising the fact that her father died from a brain tumour in 2022. And below her is Patrick Vallance, who's the new Minister at Science. Now, he comes in the post that George Freeman had, and we would really like to engage with him because he will bring in that spirit of innovation that we think is needed to cross into our world. You know, we talk quite a bit about the spirit of the COVID inquiry. Can we get that to work for with Patrick Vallance? There's going to be a brain tumour consortium. The NIHR, under quite a lot of pressure from lobbyists such as ourselves, have said that they're going to set up a brain tumour consortium. They're appointing the chairs or the leaders of that at the moment, and that will aim to build research capacity and capability, address disparities in research participation for people with brain tumours, and take a coordinated approach to collaborating with industry. And we expect to play a full part in that. We need, as I said before, to work with the regulatory authorities like NICE and MHRA to make sure that things are getting through quickly, that things aren't stopped, that there's a willingness to put warm words into actions, and that the NHS is ready for it. This is another key point. We spoke with Lord O'Shaughnessy recently, and he said to me, the good news is that on the regulatory side, things are moving much more quickly. There is still plenty of money coming in, particularly in academic trials. The next barrier is twofold, one of which is to keep growing the number of commercial intervention trials. There have not been that many in brain cancer, so we need to attract more of those. The second is then to make sure that the NHS is able to run those trials, and that is still a work in progress. And that feeds into our whole thing about translational research from the bench to the bedside. We've got to get every bit of it working correctly, from the science to the patient. And so the NHS has a part to play in that. And that is where we'll put the pressure onto Andrew Gwynn, who's pictured in the middle. So there's an awful lot to do at Westminster in 2025. And I'm happy now to hand over to my colleague Thomas, who's going to explain a bit about what's going on in Scotland and the devolved nations.
Thank you, Hugh. Just a word about the meeting with Wes Streeting first, and what he said to me was it was important that the new government has cross-government working, and when you introduced our guest today, you talked about how Will was able to work with George, and we had health and science working together, and that's very much what Wes would like to see. He also said that there was a need for more research into brain tumours and that there's a gap in the treatment pathway, and that it was really important to address the barriers to market access for the latest medicines. Right, so starting with Scotland for the devolved nations, just opening words about the devolved nations and us as a campaigning charity. The fact that we have campaigners in all four corners of the UK amplifying the voices of the community demonstrates what a difference we can make and how committed the people are. At the start of the year, we started with a bang in Scotland. So Faisal Chowdhury, who you can see in the top right-hand corner, lodged a motion for a members' business debate in the Scottish Parliament to mark Brain Tumour Awareness Month. So for a motion to be considered, it must get signatures from MSPs in different political parties. Thanks to these fantastic campaigners that I was talking about before, many of them subscribe to the weekly campaigning updates. We got over the line, and at the end of March, at the end of Brain Tumour Awareness Month, we had a debate, and the debate noted that brain tumours must be treated as a clinical and strategic priority by government as a cancer of unmet need, and it called for more funding into discovery science. We also had an event earlier in the month to mark the beginning of Brain Tumour Awareness Month. So you can see in the middle at the top, this is a photo call which was attended by the First Minister Humza Yousaf, the then First Minister, as well as Cabinet Secretary for Health Neil Gray, who's still in post, and Health Minister Jenny Minto, also still in post. The First Minister, the then First Minister, said it was absolutely vital to raise awareness about brain tumours because we know how many people can be impacted. This was followed by a reception where there were around 60 Scottish supporters, and we heard personal stories from Beatrice Wishart, who in the top photo in the middle you can see next to Humza Yousaf, and also from our charity patron Theo Burrell, who is living with a GBM. We also heard from Professor Steve Pollard, and Dr. Joanna Birch from Edinburgh and Glasgow University. And I think this is where the strength of the community lies. By bringing everybody together and demonstrating this unity, we can definitely help to move the dial. And it provides a great foundation in order so that we can create meaningful change. Meetings with MSPs, shadow health teams, and pressure from supporters put us on the path to establishing a cross-party group. And you can see that at the bottom. So that's the inaugural cross-party meeting. Evan wasn't in that photo because he was taking the picture, but he was definitely there and took some very good minutes too. Next slide, please. And now to Wales and Northern Ireland. So in Wales, we've continued to highlight the research we helped to fund. In the summer, we participated in a medical research showcase. You can see that at the top in the middle. So we were joined by Dr. Ben Newland from Cardiff University, who we helped to fund, and our fantastic supporter, Rhys Holmes. Then we've met with the Health Minister, the then Health Minister, Ellen Morgan, who, of course, is the First Minister now, along with colleagues of the Wales Cancer Alliance. You can see that in the top right. Most of the meetings are held online, but the one in the top left is an example of when we all get together. We try to do that 2 or 3 times a year to discuss important matters for the cancer community going forward. And in Northern Ireland, we were part of the inaugural Cancer Coalition event, which Hugh then followed up with an event in October with a brain tumour research event in Scotland. You can see him pictured there with the minister and one of our fantastic supporters, Cara Hunter, who is also a politician. So, very meaningful what she says and what she does. And do politicians get the benefits of more research? Because we constantly talk about the benefits of more research. I would say absolutely. An example of this is that the chair of the cross-party group on cancer in Wales, David Rees, recently said, research saves lives. Every pound invested in research generates multiple returns, not just in terms of money, but also in terms of outcomes. And if you can go to the next slide, please. This is like a summary of things that we will be involved in next year. So very much looking forward to following up the first cross-party meeting on brain tumours in Scotland with our second meeting. We'll be meeting next week, actually, with the chair of the cross-party group, Beatrice Wishart, to discuss what we're going to do in that second meeting. But the first meeting fills me with optimism. MSPs came prepared, and it was almost run like a select committee meeting. And most of all, the supporters that came to the meeting felt as though we could go somewhere and we can achieve this change, that it's within reach. Also, in January, we're very much involved in the less survivable cancer task force, both in Scotland and at Westminster, and we'll continue doing great work through the different alliances and coalitions that we're proudly part of. And that's all from me.
Okay, thank you, Thomas. Back with me now. That photograph, I mean, quite often what I'll say during presentations is there are two types of research. The research that we fund, and that's a photograph of the research that we fund. There are brain tumour research supported scientists and researchers. Our annual researcher workshop, which took place in York only only a couple of weeks ago. And in fact, Dame Siobhan McDonnell came up and spoke to these folks to chivvy them up and say, "Come on, we can do so much more." And that was really they were really appreciative of that. So that's a great photograph of all of the people that we're funding. So that's the research that we fund, and then there's the research that we can influence. So we're very clear. We've always been clear as a charity, and those of you who've been with us for a long time will know the ethos of brain tumor research is that we can't do it on our own. If you've got 86% of brain tumor research being undertaken by charities or underpinned by charities, that's not sustainable. So we need the government to step up. And I think when we chat with Will in a moment, we'll talk more about the fact that the political will is with us. It's actually getting the deployment done that's the important thing. But as a final sort of message from me as a campaigner who's been in this space for such a long period of time, I look at the money that's gone into through the UKRI and LifeArc and Cancer Research UK, and what they're saying is their strategic aims with brain tumour research and their commitment to put more money into it, the NIHR and the consortium, and the fact that there's a link now with Minderoo to do more surgical work around brain tumours. So much is going on. I'm more optimistic than I've ever been. But what I would say, and this is a quote from one of my campaigning updates, is whilst we cannot claim this with certainty, as brain tumour campaigners, we feel that the noise we have been making, and that's everyone on this call, that's the 1,500 people we speak to every week, the people who write to their MPs, the people who try and get their MPs to ask questions, the people who try and get their MPs to attend debates, the people who try and get them to join the APPG. We feel that the noise we have been making for the past months and years must have some influence in preparing the ground for such a clearly favourable landscape for funding brain tumour research. So that's my optimistic end to this. And now I'm really just so thrilled that we can have a chat with Will Quince, who served as a member of Parliament for Colchester from 2015 to 2024 and was the Minister of State for Health and Secondary Care from September 2022 to just over a year ago, November 2023, and was always a great friend of brain tumour research. So I'm delighted to stop sharing my screen, and hopefully, Will, we can hear from you.
Thank you. And it's a pleasure to join you.
Thank you so much. Well, right, that's good. I'm quite relieved that PowerPoint was over. It was we were saying it doesn't get any easier, but I'm pleased that we have a chance to chat with you for half an hour. Thank you for your time. Will, when you tell me about how you first became aware of the brain tumor issue, how has it come across your desk?
Yeah, in truth, I think we all probably sadly know somebody in our family that has been touched by cancer in some way, and then you don't have to delve too deep before you find somebody that has experienced a brain tumor or brain cancer in some way. And so I was always aware of it. But until I was a health minister and had responsibility for life sciences and NIHR and research, it wasn't really until I came across both you and Thomas, but also a number of parliamentary colleagues who would bring constituents in who had tragically, in some cases, lost a child, in other cases, lost a husband, a wife, a close family member to a brain tumor. That you then realize that there was an issue here when it comes to research, and the fact that actually there is a real gap here in not just our knowledge, but also I think the work being done within the department and cross government in this important area.
Well, maybe we'll talk about cross government in a moment. I mean, you talk about the lack of knowledge, and I know that when we were with George Freeman, he would talk about the last three areas that we know very little about are the ocean, space, and the brain. And I think that is a quite a profound way of looking at it. The issue about funding, though, if we can look at that first. We know that if you invest in research, you will get closer to cures and breakthroughs, and if you don't, you won't. And it would have been something that you'd have been aware of, that money was made available in
Hmm.
2018, the 40 million pounds. What were your thoughts when you found out actually that so little of it had been deployed?
Well, so initially, I had, I think I can frankly say, quite an aggressive, and I don't blame them for being so, constituent and parliamentary colleague who were understandably, metaphorically chest pressing and saying, "What on earth's going on here?" You know, a 40 million pound budget was ring fenced and was allocated specifically for brain tumor research. Why, I think even when it came to the end of last year, depending on how you cut the figures, it was either 15 or 33 million pounds, probably realistically more the former number, had actually been spent on brain tumor research. So in theory, it's an easy fix, right? Because the money's there. Why isn't the department spending it? Something's clearly going wrong. So when I got back to the department, met with Lucy Chappell, who's the chief scientific advisor at the department. She also heads up as chief executive of NIHR, which is the government's funding body specifically on health. It's then when you start to deep dive into that, and actually, there's only two areas, to my knowledge, where money has been ring fenced. One was brain tumor research, and that was 40 million pounds in 2018. The second was MND, and 50 million pounds was ring fenced. And funnily enough, they had exactly the same problem. That ring fencing money does not mean that it's going to be spent, and it does not mean that it's going to be allocated in the way that you would expect it to. So this money was sitting there. Actually, what I found out, which I was pleasantly surprised about, there was a willingness to spend far more than 40 million if high quality fundable bids came forward. So deep dive into what was going wrong here, because it clearly isn't a will and it clearly isn't the amount of money that's available. So what was it? And I think there are numerous ways in which you can look at it, but I think, as you say, there is a relatively small patient group that has tragically very poor prognosis. It's a complex organ that we know very little about. There have been few clinical trials, a lack of interest from pharmaceutical companies. Not to mention the fact that an average pharmaceutical company is about a 15-year process from basic science through to any kind of drug or treatment or therapy in any event. Then there was a lack of quality fundable bids coming forward. And then there was also, notwithstanding the huge efforts that you and so many other smaller charities put in, there was a lack of charity funded research as well, compared to some of the higher prevalence cancers that are out there. So we could diagnose what the problem was, but how do you then go about addressing that and fixing it and making sure that more money was being spent? So I looked again. I thought, right, we're in the business of solving problems here. Is it a case that these bids just aren't getting through, and why? And we looked therefore at the percentage of bids that were put forward for brain tumor research versus, say, breast cancer or many of the other types of cancer. And actually, the rejection percentage was about the same, broadly within a 5% variance of other cancers. So it wasn't just that the bids were particularly poor. It was largely about the number that were coming through and were therefore fundable. So we looked at a different model, and that was, how do you therefore work with the researchers that are putting forward bids that get rejected to help them get to the point where those bids can become fundable? And then how do you get more people submitting bids in the first place? And that's tricky because you've got few specialists in this clinical area, and therefore even fewer that then go into specifically research that then put forward bids to NIHR and others. So it was a challenging one because the money was there, the will was there, but there was a real challenge in terms of getting fundable bids forward that would then lead to research actually being undertaken.
How much of it do you think was a cross-departmental issue, Will? Is that, how communicative between DSIT and DHSC were you in terms of getting stuff from the scientist bench to the patient's bedside? Because if you don't have the kickoff and the seed funding at that end of it, you won't have anything at the clinical trial end of it.
I think that's right, and we tried working with George to do more of that, and I think it's great to hear that Wes and Andrew, who are both brilliant, by the way, uh, and really care about this issue because I've spoken with them about it both in when they were in opposition and since, even though I'm out of politics now. But the fact that Wes is so keen to work with Peter Carl, the DSIT secretary, to really drive this forward on a cross-government basis, I think is really, really important. The other two, which are the key to this, are the Treasury because of the release of funds, but also number 10, just to get that cover and backing from the centre for a real push in this area. But I think what you're doing already, and you use the word noise, so I can use it too. I think actually the noise and the tempo with which you and Thomas and so many of the campaigners that you have around the country in all the constituencies do make such a big difference in terms of keeping this alive and on the department's agenda. Because I think for too long, because the money had been put there and they were struggling to spend it, it was almost put in the too difficult box. Because I remember when we sat down with George and discussed this, we need to get upstream. We need to get more fellowships. We need to get more people in the early stages of research. That then means we can get more fundable bids coming forward. So we'd love to be in a position, I think, and I say we, the royal we, as in as a country, where we're spending far more than 40 million on brain tumor research annually, but we're not there yet, and it might take a while for us to get there, to get more of those individuals coming forward into research and then putting forward those fundable bids.
Thanks you. Just to everybody who's listening, if you want to take part, please put things in the chat. People will pick that up, and we can move forward with that. Will, can we go back to the comparison that we have with MND and brain tumor research? I mean, I think that obviously there was a very public lead on that in terms of Rob Burrow. I mean, how important is that? And what are the learnings that you feel that we might be able to take as a community from what happened with MND? Because they did get the money out there. It took a time. It took a time. They identified this sort of issue. What do you think that they did that was
Well, they did, but very similar to you. I remember being in the department at the time, and actually the danger when, and this was when Steve Barclay was Secretary of State, and Spads would come up saying, Secretary of State, there's huge criticism here because we haven't spent the money, and he was saying, well, what do you mean we haven't spent the money? Why on earth haven't we spent the money? And it was a very similar challenge that the fundable bids that were of a sufficient quality to pass the bar alongside all other bids that were coming forward, because NHR have to look at these things in the same way as they do every other bid in terms of does it meet the bar to be fundable. And I think that there is my hunch is governments are going to look very carefully before they set up pots of money like this again, because I think the danger is you're then rightly held to account to spend it. But if you haven't got a plan when you allocate the funding on how you're actually going to spend it, and spend it in a way that meets the government's rightly so, value for money criteria against all other different medical issues that people are putting forward fundable bids for, then we can end up back in this situation. But to your point, I think it's not just about the allocation of money; it's about keeping it in the consciousness of politicians, of the department, but also the public. And whether it's things like, as you rightly say, Rob Burrows or Doddy Weir on MND, or it's things like the Sunday Express, who pushed very strongly on fracture liaison services around the country, or going back a little while, Joanna Lumley, who campaigned very, very vociferously for Gurkha communities, or Marcus Rashford on free school meals, or Esther Ranson, more recent one on assisted dying. These do make a difference because these campaigns bring energy and a sort of sense of raising the profile that then across the country pressures put on individual MPs. MPs then put pressure on ministers. Debates come forward. Civil servants then have to, draft research papers, and it just gets the whole department and government therefore thinking about particular issues. And I think that's why I came back to that phrase noise, because you are very good, I think, and have been for a few years now, at really making a lot of noise. And I think that is, hugely to your credit. And also the tempo with which you campaign, I think, means that brain tumor research has been very much alive and at the sort of centre of government and certainly the departmental, in terms of Department for Health, thinking for quite some time now.
Yeah, thank you. Will. I mean, I think that the point about the ring-fenced money is an interesting one. It's certainly the point we came away from the meeting with you and George about, is that actually, if you say we want, say, 50 million pounds, and that you say there is 50 million pounds, then it's actually a number that you get beaten up with then for the rest of the duration of your time in office. And I think that perhaps now a charity like us should be more prescriptive when we come to you and say we want 5 million of that spent here, 7.5 million there. I don't know what you think. What you think about that? There is the other thing I would say. There are two things actually. One about the pressure that we put on, that gets sort of, it goes in linear fashion up to the Prime Minister or the Secretary of State, and then comes down to the ministers and to the civil servants. You spoke about the fact that the 40 million at one point, the spend was 11.3, and then suddenly it came back as 33 point something else. How did that work? Where was the pressure for you to change that? I know where the figures come from, but you were cutting and dicing them completely differently.
Yeah, they do, and I think it's on numerous things. So they'll look at research around sort of different areas. So in some cases it'll be about innovation and novel therapies. In some cases it'll be around specific research, and then in other areas it'll be around I think around my understanding. I'm sort of thinking back, but I think it was around sort of treatment and support and other areas which were more broadly around cancer. So not just specifically on brain tumor research. So I think there's all sorts of ways they can sort of cut the numbers, but I think realistically, when I looked at it, it was more the 12 to 15 mark that was more realistic in terms of how much was really spent on what you would have, when setting up the 40 million, expected to have gone on brain tumor research. But I think, going back to the frustrating thing, Hugh, was that every single person I met with, you were pushing against an open door. There was nobody saying, I wish we hadn't spent this much, or could we just rein this in? It was actually, how do we spend more? How do we get more fundable bids coming forward? And there was a real, I think, keenness from Lucy and everyone down from her, really, to spend far more than the 40 million if there were those fundable bids coming forward.
So we get to the point then about the nature of fundable, an idea of
Yeah.
innovation and being less risk averse. And to the point of, if you do what you've always done, it would be, if you say we will, this is our bar and we won't change that bar. This is how we operate. That's fine. And then when you finish working at the NIHR, say I didn't change my standards at all. It's still the biggest cancer killer of children and adults
It is.
under the
Yeah,
age
it is.
of 40. Is that the way that the funders should be operating, or should they be looking at things in the spirit of the manifesto? Let's do things differently.
Well, this is where I think I disagreed with the department, because I think the view was that the bar is the bar and it's there for a reason, and that's because you should treat all bids in the same way in terms of conditions. And there is a part of me that agrees with them to an extent, in that there is something about just those who shout the loudest, and you have got to be really careful, because there are charities, for example, that can raise money and hold an event in Parliament. And there were events that I went to, especially with rare conditions and diseases that impact children, where you come away thinking, oh my God, this is awful. And you go back into the department and say, we've got to do something. But then there are 80, 90, 100 other charities that represent other small, rare conditions that affect children in the same way. And it shouldn't just be about who can get in front of a minister that then can go and seek a department to do something. I think where this is different, and where I disagreed with the department, was that, as you rightly say, brain tumours kill more children and adults under 40 than any other cancer. yet accounts for something like 1% of the research funding. So there is clearly a difference there and an issue there that I think deserves a special case when it comes to looking at how can we treat research in this area, given how little we know about the brain differently, and how can we fund innovative and novel therapies and optimization of treatments and ways in which we can support and care for those with brain tumors differently. And I think we sort of saw a bit of the start of that in earlier this year when Andrew Stevenson chaired the round table. But I think it's just the start, and I think there's going to be a real need to change the mindset of NHR in the way that things have always been done.
And I think this might come in a bit towards cohort size as well, because we can't get the big trials because we don't have the patient numbers. Then it's something that Jenny brought up in in the chat. So into this, so there is another player, Will, that could have a huge influence here. What can we do to put industry in the mix with government and academia? And is that indeed the role of government to do that?
Well, I mean, as Thomas rightly points out, in other countries they do. They incentivize industry. You you can certainly do it via NHR funding in certain ways, although it's limited. Um, there is something about using public profile and to sort of push industry in the right direction. But there is only so much leverage that I think we collectively have in terms of campaigners, but also as government to push industry in a particular direction without, as Thomas pointed out, actually incentivizing them to do things, especially when in when it comes to sort of very complex drugs and treatments, it can be a 10, 12, 15-year process and costs an enormous amount of money. Um, the honest answer is I don't know. George is probably your better person on that because of his the work that he did in DSIT and sort of his connections in terms of industry and the way that they think. But I think where you're absolutely right is industry has got to be part of this because of um, the the huge amount of research that they undertake and the yeah, they've got to be part of this, and they are a missing piece at the moment because of the lack of research that industry sponsors and puts forward at the moment.
And so, to my next point about industry would be about the regulatory bodies, because the tragedy would be is if actually in this area where we've had no progress for so long, and we feel that we're getting towards some forms of progress, where the regulatory authorities actually then started stymieing it. And I'm interested in the relationship between government and NICE, and the fact that if NICE make a decision, where government sit with that, because clearly they're not an autonomous body. You can challenge them, but is there a default position that, well, that's what NICE said, and there's nothing that we can do about that.
So it does tend to be, yeah. Because of their independence, government does tend to respect the view that they take. But I think there is no reason why you can't have those early conversations with people like Sam Roberts, who's the CEO of NICE, and making sure that they're aligned to sort of your thinking on this, and making sure that they are looking at things that might come forward in this space in context. In my experience, they're actually pretty good at that. I understand why you'd be concerned about it, and that it's another sort of potential barrier you want to avoid and, if possible, remove. But I think working with them and at an early stage as possible, I think is the way forward.
Okay, I'll come to a couple. There've been a couple of comments, but I just wanted to follow up on that, if I may, um, Will, and that's about that access to NICE. How best to go about that is that, if we've got connections as we had with you, as we have with Andrew Gwynn, to do that through parliamentary connections, or to go direct ourselves. I mean, what's the
A
best
bit,
way
of,
of
yeah, a
working?
bit, a bit of both. Actually, I mean, Sam really is a breath of fresh air as a chief exec. I thought she was brilliant, and still do. I think the number of events that I would see her at where she meets with and listens to patient groups and charities and campaigning organisations, I think is really refreshing. She's not one of those that sits in a metaphorical ivory tower in Whitehall. She really does get out and listen. It doesn't mean she won't push back and challenge and sort of set what's within her remit and what's within the art of the possible, and not. But she is someone that listens. So I would whether it's through DHSC or whether it's through your own convening power, organize a round table where you can sort of set out your case, if you like, and then listen to what she has to say, and then from there you'll know what direction you need to then sort of drive the campaign, if that makes sense.
Yeah, it does. Thank you. Just going to go to the chat. Carol, welcome. Thank you for joining us. Carol is in Canada, I believe. And he's asking about the percentage of fundable bids for brain tumor research which are successful and get funded. I think I have an idea of this. I don't know if you do.
So I don't have that to hand, and they understandably and rightly take all the documents off you when you leave office. But I think, Hugh, I shared those figures with the charity because we it was one of the things I wanted to find out, because if it was the case that there was a far higher rejection rate for brain tumor research than there was for, say, breast cancer, or then that would it sort of signal a problem. Unfortunately, it didn't, and it was broadly in line, as I recall, with other cancer types in terms of rejection rate, which meant we then just had to find a sort of another route. But we can probably share that because it's all public domain.
Yeah, I think, and my colleague Dr. Karen Noble, who has worked for Cancer Research UK, I think she's said that the strike rate of about 10% is about where we think it sits. I mean, I'd then revert to my other point that if you're actually going to really make a difference, you have to look at that and sort of say, actually, just being the same as everyone else isn't what you want. You want something better. And that actually brings in a little bit about comparators here, Will. Alison has just been asking about what the situation is in other countries. Now, I don't think that the charitable funding model is the same for research in other countries, but I would like to ask about the role of the international comparison in terms of energizing politicians, because it always seems to me quite a strong weapon to go in with to say, well, you could
Yeah,
do this in France or.
it does, and often what they're not doing is comparing apples with apples in terms of the way that statistics are put together. But the truth is, we probably don't do anywhere enough with some of our international comparators. I think where you've got so something like brain tumor research, in my mind at least, it's eminently sensible for us, given that it is a relatively small number of people every year, that we should be looking internationally and to see where we can collaborate. And there's a bit of that done across Europe, but I don't think we do anywhere near enough with the United States, for example, where so much research is undertaken across the board on cancer. And I think we should be doing more. At the moment, you can't pull or put NIHR funding, or we couldn't have allocated some of the 40 million, for example, to a pan-European study or a piece of research or something with the United States. That's all individual conditions on the funding pots that are available, and that's all set by the Treasury. But it's something that could change, and something that we should I think be looking for, because this isn't a challenge unique to the United Kingdom. It's a challenge globally, and we should be looking to work together with sort of counterparts to see, especially those that have sort of similar health systems to ours, to see where we can collaborate and work together on research and pool our knowledge.
Because things can change. Everything can change. These aren't eternal truths, are they? The thing I suppose that's the real agent for change at the moment, and Jenny has been asking about this, and I was just throwing this one out there, is the role of AI. What impact might this have in this area? And it might not be one for you, Will, but certainly it feels, from my perspective, with a slightly more PR hat on, if we could get Patrick Vallance along to one of our labs and show something with AI centre to it, he might come along to that because it seems quite buzzy at the moment. What thoughts did you have on that before you?
Well, I think the more I see of AI, the more potential I see in healthcare. And it's never ever going to replace the need for a clinician. But I think what it will allow is us to, especially when it comes to diagnosis and scanning, to be able to spot things at an earlier stage that the human eye potentially can't, or far faster, and direct things to a clinician for then further investigation. So I think the opportunities are bordering on endless, and I think we should definitely be exploring ways in which AI can be used further in research.
Yeah, and I'm sure that is going to be the case. Certainly, I think at one of our imperial centres, there's a lot going on. We've got 5 minutes, Will. If we were to swap places, and obviously an unlikely scenario, me being a health minister. However, if I were the health minister and you were a brain tumour campaigner, what would you be doing to me now? What would be your sort of MO?
So I think Hugh, you and Thomas already do all the right things, and for ministers come and go, and my time came and it certainly went, and I was one of the few that got to go on my own terms. But I think the problem is, and I just take the Department for Health as one example. You will have multiple meetings a day. Your whole day is largely reactive because of events and things that you need to deal with. And so many charities and organizations will come in and they will, yes, make their case, but it will be really, really negative. And it will always be about, you're not doing enough of this, we're not spending enough on X, Y, and Z. And I think what's really refreshing about the approach that you and the charity takes is you make the case, but you are relentlessly positive about what more could be done with more. And importantly, you offer solutions. So you go away from that meeting and you're able to say to officials, where are we with this? Could you speak to an HR about that? Can you find out why we've only got this percentage of bids that are fundable? What are we doing to support researchers whose bids are rejected to make sure that they can resubmit their bid with support to get it to the point at which it's fundable? So you're going away with informed questions which enable, well, it forces the department to come back and answer them. And it therefore keeps the issue and agenda alive. And you're not just leaving that meeting feeling a little bit like you've been browbeaten and it's just another problem that's added to the list. You'll go away thinking that actually there's some hope that we can do something positive here and drive some real meaningful change alongside this charity that wants to work in partnership with government to deliver an objective. And I think it's that sort of making the case but staying relentlessly positive and offering solutions, which is the way that you get things done in Whitehall.
Thanks. Um, I think the thing that I found with working with politicians is by nature you're problem solvers, and so if you can be sort of encouraged towards a path that presents a solution, that you will walk that path. I think that when you talk, it is Thomas and I, but it's all of us. It's the 1,500 people who are on our campaigning database, all working together and talking to their MPs, asking them to ask questions, asking them to attend the APPG. I mean, I'm assuming, Will, that you are a fan of APPGs and in terms of what they can do.
I am, and also don't underestimate the power of an MP calling a debate, and in Westminster Hall or in Parliament, and it might only last half an hour. But the thing that's really powerful about it, and people don't realise, is for the 2 weeks in advance of that, the department have to brief the minister and make sure that they have a speech, a response, questions that are likely to be asked, suggested answers to all of, and you sit down with the team that are experts in that area, and you run through the policy issue. Now, what that does is two things. It forces the minister to focus on that issue, but it also forces the department to focus on that issue because the team are then thinking, oh, we've got a debate on X, and now we've got to make sure that we're briefing the minister properly and we've got all of that information to hand. And they then go to NIHR and they go to UKRC and others and ask lots of questions. And then it's yet another, oh, brain tumor research is on the agenda again. So it's really actually powerful to just keep those debates coming through, because it keeps it in the minds, front and centre, in the department of amongst officials. So it's a really powerful tool, and yes, I agree with you. APPGs are powerful for the same reason, in that the more MPs backbench that you get interested in a particular subject, then the high likelihood that they're going to ask parliamentary questions, they're going to put in for debates, and they're going to go and speak with ministers in the lobbies and in the fringes of events and that sort of thing.
Okay, well, the power really lies with the patients too, and well, I've just had a chat note from Caroline talking about Fraser, her son, who died at 18, who was overseas for trials because he couldn't get onto a particular trial here, and that is the sobering fact that underpins all of what we do, and I know as a humane man yourself, that would affect you as well. And I think we're ready to close out. I just wanted to give sincerest thanks to you for joining us for this.
No, no, GQ, it's really kind, and it's my pleasure, and I'll help in any way that I can, just as member of the public. But if there's any sort of insight or experience that I can share, and I know George would feel the same, from my time in Westminster, I'd be delighted to do so. But I say this as someone who was on the different sort of political aisle from them, but actually, Wes and Andrew and Peter, they are really good guys who I think get this, and I think that they are advocates and allies of yours. But we've just got to keep making the case and making sure for the department that we're seeing that they get that there are innovative and new and novel ways of approaching this, and it doesn't have to be the way it's always been done. There is a better way.
Thank you, Will. Thank you so much. Thank you, everyone. Thank you very much for joining us, and we will have another campaigning update soon. Bye. Thanks, Will.